There is a lot of marketing around baby products, probably now more than ever. What are just like the bare bones must-haves to keep babies safe and healthy?
Yeah, I mean, there is so much information out, and a lot of it is very unnecessary. And my thing is just keep it simple.
Yeah.
We want to empower you to make fully informed choices about your pregnancy and parenting options. Let's talk about what's next now that pregnancy has entered the chat.
Welcome back to Pregnancy has Entered the Chat. Today we have Amanda Summers on the podcast. Amanda is a volunteer at the Pregnancy Network for our Pregnancy 101 class. Amanda, welcome to the podcast.
Thank you.
Today we're going to be discussing newborn care. Amanda teaches this topic for our Pregnancy 101 class, and we're going to be going over some of the need-to-know information for taking care of your newborn after you get home from the hospital. Amanda, is there anything you'd like to say to our listeners before we get started?
I mean, I think the main thing and hopefully the big takeaway is just give yourself a lot of grace, right? So you just spent 9 months growing a human inside of your body, then you brought them out.
Yes.
And now you're just left, you're healing yourself. And then there's this newborn that you're just trying to keep alive.
Yeah.
And you may have had this perfect plan before, and it may not have gone exactly like you thought. And it still may not be going exactly how you thought. And so really just giving yourself some grace that it might not work out perfectly, but it's working out.
Yeah, that is so good. I think every new parent needs to hear that and hopefully drop their shoulders a little bit.
Yeah.
All right. So I think many parents, like you said, get home from the hospital and think, what do I do now? Maybe things aren't going to plan. How can parents equip themselves with the information they need when their baby comes?
I think a lot of it is just preparing as much as you can ahead of time. So that is sort of doing a little research on your own, but also asking people. So I was very big on asking like friends and family, hey, what really helped you during this time?
Yeah.
What could you not live without? What advice could you really give me
Yeah.
as we're going through this time? And you'll find a lot of helpful information. They've probably done the research themselves, and they can just go ahead and give it to you, whether that's a book, it's just sort of the tools that they've used, or, a podcast like this to check into.
Yeah.
And the other thing is just doing your own research. So right now there's so much information out there on social media, the internet. And then there are specifics. So like there's lots of information on breastfeeding, lots of information on sleep training.
Yeah.
And so it can get overwhelming looking at that. You want to make sure that you're looking for viable information or information that is correct and not just something that somebody's aunt said on the internet. So
Yes. I think it's important, like you said, choosing those voices to trust. Like if you have people in your life, that's a super good way to start. But then online, like once you find something that kind of maybe clicks with your instincts and works for you, like just putting on your blinders almost a little bit, because it can be a little
another
overwhelming.
thing is, as you're trying to find a pediatrician, a lot of them do like prenatal visits or post or pre-baby visits. And during that time, they sort of talk to you about what to expect, like at your first visit, what vaccines, those types of things. And so I really encourage, if you have a pediatrician or a doctor, to meet with them before to discuss things. So that sort of helps to get you ready for what comes next.
Yes. No, that is super helpful, because in a lot of pediatricians now, I noticed when I was looking, like require that first visit during your pregnancy. And so it's helpful to just get on there and see what's going on, because it can be really helpful. You get to your first appointment a few days after your baby's born. You're like, what's going on? What are we doing?
Well, and two, there's so many visits in the first part. So you're doing weight checks, you're having home checks, And so if you don't know it's coming, you're just sort of like, we're supposed to be doing what? Yeah.
Yes.
Preparing is good.
No, that's so good for people to know. And we talked about, some of those must-have items, asking other moms. There is a lot of marketing around baby products, probably now more than ever. What are just like the bare bones must-haves to keep babies safe and healthy?
Yeah, I mean, there is so much information out, and a lot of it is very unnecessary. And, and my thing is just keep it simple.
Yeah.
So what are the main things? So you want to think about safety. So you're going to think about where can they safely sleep. That will be a bassinet, because we don't encourage co-sleeping. So we have a sturdy bassinet, you want a crib, you want a pack and play, which is really good. So for like us, we have a 2-story home.
Yeah.
And having that pack and play downstairs was a safe way for us to change the baby's diaper.
Yeah.
Or even if you have to run to the restroom or something, it's a safe place to put baby where they're not just laying on the floor or that pets can get near them.
Yeah.
The other things that you want to think about is car seats. So there's so many car seats, but you want to make sure of the ones that, have high safety ratings. They have a lot of all-in-ones now that grow with them,
Yeah.
but you want to make sure that that car seat is not expired.
Yeah.
The other things are like bath time. So you want a nice bathtub baby tub that they can fit in and that it's safe for them to bathe. But then, you have your normal everyday things. So you're going to want wipes, diapers, you're going to want swaddles, pajamas that zip from the bottom and the top. So that at nighttime when you're changing, it makes your life easier.
Yeah.
Plenty of bottles, a way to sterilize the bottles, those types of things. And big thing as far as like health, I guess, is making sure that you have a rectal thermometer. So under children 0 to 12 months of age, the most accurate way to check their temperature is through a rectal thermometer. And they have a lot of good ones out now that make it easy for parents to read and understand, not feel scared to try it.
Yes.
So those types of things.
Yeah, that is so helpful to hear because there's just, there's so many things you can add to that list, but there's also, just knowing that I can get a pack and play that'll work as bassinet and then work as a crib or whatever it is.
And travel,
Yes. And at the Pregnancy Network, I'm sure at our classes, we give out a lot of these items. And so if you're local to the Triad and you're like, how am I going to get all of those items? Come on over. We've got plenty of stuff in our resource room and we're happy to give those out to our class participants. And it's a great way to get started with just those basic items.
Yes.
So newborns don't do a whole lot other than eat, sleep, use the bathroom, and tummy time. What are the need to know things in each of those areas?
I mean, with newborns, you really want to watch for cues that they do to let you know about these things. Especially trying to get ahead of them before they get past that point of what we call being hangry.
Yes.
Or being tired. And even for us, when we're overexhausted, we're tired, you get very irritable. It's hard to kind of calm down. Same with babies. So the cues that you're looking for with hunger is they're going to start clenching their fists. They're going to start rooting. They're going to start, trying to suck on their hands and kind of puckering their lips. As far as when they're tired, they're going to start yawning. Their brow is going to get a little discolored. They're also going to start to get a little fussy. So those are sort of your cues of, feedings and then sleeping. And a lot of times newborns, they mainly sleep. So from 0 to 4 weeks, their wake time is only like 30 minutes to maybe an hour. And then for another 6 to 12 weeks, it doesn't increase, but about 30 minutes of wake time. So they sleep the majority of the time. But as far as like bowel movements, so newborns, they're going to have frequent bowel movements. It's almost like with every feeding. You'll notice that with breastfed babies, it'll be more like yellow, seedy, thinner consistency than more formula-fed babies. And then when you're wanting to change their diaper, you want to change it pretty frequently because you don't want them to stay in the stool or in the urine because it can break down their little skin barrier. So making sure that you're changing the diapers frequently. I strongly suggest using sensitive wipes or just water wipes, avoiding things with fragrance because that can also break down their little skin that's new. Vaseline, having that available, diaper cream, those types of things. But things that you want to worry about as far as with diapers, if you notice any blood in the stool, that can be alarm for many different things, and irritation as well. And the other thing is if they do not have any wet diapers or a stool in 6 or more hours, that's concerning because then you feel like they're getting dehydrated and you need to get that checked.
That's all good to know. I know it's, the cues and everything can sound overwhelming, but you really do pick up on them.
You do. I think the first couple of days you're both trying to learn each other.
Yes.
And then eventually you just sort of start to maybe even get in a schedule, but
Yeah.
you start to understand their cues and their different cries
Yes.
where you're like, oh, we're tired.
Yes. It is funny. And when I had my son and he was so little, he would be on the floor or on his little play mat and he'd be playing, maybe for 5 minutes and then all of a sudden crying. He's just exhausted. I mean, like they really just have such a short amount of time, but just those basics of the diaper changes, keeping them dry and clean and all the good stuff of learning their feeding cues and all that is really important.
Yeah. And being prepared for blowouts.
Yeah.
So that's a big thing. I mean, I feel like maybe it doesn't change. We have a 2.5-year-old and we went out the other day and, I was like, oh, we haven't had that in so long. And then, of course, we had a blowout out of nowhere. And I was like, did I bring extra clothes? But packing extra diapers, extra clothes, those types of things, just being prepared because it will happen.
Yes, and fun fact about blowouts is they always happen at the worst times. It's just a rule of life, I feel. So you're on a road trip or you're at somebody's house or whatever, and it will happen. So backup outfit in the diaper bag, 2 thumbs up.
Oh, yeah.
And then talking about something that nobody likes to think about, but what if your baby gets sick? Like, what are the signs to watch for and what should you do?
Yeah, I mean, it's sort of like when we get sick. So you'll notice a stuffy nose, you'll notice a runny nose, as a clear, yellow, green, those types of things. They might have a little cough. They might have some vomiting, some diarrhea, those types of things that you want to look for if they're sick. They're extremely fussy. They're not sleeping well. They may feel hot to the touch and you check their temperature and anything over 100.4 is considered a fever.
Yeah.
And that's when you want to contact your pediatrician. So we talked earlier about doing a pre-visit with them to see. And one of the big questions that you want to ask your pediatrician is, do you have a triage line that's both during hours and after hours? Because that makes it easy. So if you're just like, well, we've started with a stuffy nose, should I be concerned? You can call into that line. They'll ask you some general questions. You answer that, and they can either say, here's some things to do at home, or let's make you a visit and go ahead and schedule that. Or if it's something bigger, they can direct you to the emergency room.
Yeah.
And that's really big for nighttime too. So asking them, does that triage line, do you have one at night too? Because that's when everything happens, right? So making that a big priority and checking. But the big thing with newborns and stuff is keeping them from getting sick.
Yeah.
And so a lot of that is babies can't talk. So you have to be their advocate.
Yeah.
So of course, everybody wants to come visit them and that's great. But you have to say, hey, before you hold the baby, I need you to wash your hands.
Yeah.
I need you to sanitize your hands. If they have a little cold, the sniffles, they might just say, oh, it's allergies. Well, I'd appreciate if you wear a mask while you're holding the baby or maybe just wait a couple more days.
Yeah.
The other thing is avoiding big groups. So you're going to get right near the holidays.
Yeah.
And everybody wants to get together and you want to see everybody because you've been stuck in the house. But the baby's not fully built their immune system. They haven't got a lot of the vaccines that help protect. And so you really want to limit the amount of people that they're around in the crowds as well. So just sort of advocating for them.
Yes. Yeah. That was my baby was born on Christmas. And so it was like if a whole family's in town and at the hospital, they will tell you to like first 2 months, like really try to avoid church, avoid these places, bringing them out. And, it's important because the best way to take care of a sick kid is to avoid them getting sick in the first place.
And one of my husband's cousins had the best idea, and I didn't think about it, but it was coming up around family time, getting together, and it's a large family. And so what she did was she put the baby in the carrier, the wearable carrier. And so then it's like that keeps people from coming to them, and sort of getting all in your space too.
Yeah.
And so that really helped avoid people not coming to touch the baby.
Yes.
And another thing is you'd be surprised when you go out and about how many people just come up. And even though you have a cover on the car seat, but they just fold it up.
Yeah.
And you're just like, no, what has happened?
Yes.
So I ended up getting one that sort of zipped,
Yep.
that had the mesh thing that you could see the baby could breathe well.
Yeah.
And that worked out great because nobody randomly could just come and pull it up and be like, oh, I want to see baby.
Yes. Yeah. And there's a polite way to be like, hey, please don't touch them. They have a little immune system or whatever it is. I mean, even my husband will take our baby out and people will just come right up, touch his face or try to. And
Yeah.
it's a little crazy. But it's important to keep them as safe as possible and avoid those big germs that their immune systems aren't ready for.
Certainly.
So, what are the other important safety items that we should go over just for people to know in the back of their minds?
Yeah, I think the big things are your safety. So that's going to be your water safety, falls, and then burns.
Yeah.
So when we talk about water safety, babies or children can actually drown in less than 2 inches of water.
Yep.
And that's scary to think about.
Yes.
And so you never want to leave your baby unattended, like during bath time, or even if you're like in a pool float, anything like that. You never want to leave them unattended,
Yep.
because anything can happen. The other thing, and with like you're thinking about a bathtub, you want to find something that's safe for them, that can keep them upright, but also a way to check that temperature.
Yep.
Because you don't want them to get burned or it to be too cold and uncomfortable.
Yeah.
And so when we talk about burns, we're going to talk, they could get burned in bath water. But the big thing is avoiding, drinking hot coffee or a hot tea or hot soup, because babies startle very easily.
Yeah.
And that can startle you. And then you can drop that hot food, hot drink on them.
Yeah.
And that's where the majority of burns come from.
Yeah.
And so limiting that. The other thing is if you use hot tools, or an iron, clothing iron, you want to keep them out of the reach. Babies can grab anything. They just have unrealistic strength.
Yes.
And they'll surprise you by grabbing something, even if it's just the cord, and then it falls down and it burns on them. So definitely watching for those things.
Yeah.
And as far as falls, I mean, babies can fall anytime, even if they're not mobile, like crawling, walking. So if never leaving them unattended. So like on the diaper changing table,
Yeah.
making sure that they're strapped in, that you're attending the area, or don't place them on the bed. Even if you're like they're in the middle of the bed, somehow they get to the side of the bed.
Yeah.
And that's where the majority of falls come from. Chairs, couches, those types of things, making sure that they're attended to and right there with you.
Yeah. And if a baby does fall, like, I feel like there's different types of falls. They're like sitting and maybe they just like topple over and they're probably okay when they do that.
Yeah.
But where's like kind of the ratio or things to look out for if they have got like a goose egg or on their head?
And so with a fall, the big things that you're looking for is, are they alert? So are they responding to you? Are they, if they're uncontrollably crying and then you can't get them calmed down after a certain amount of time, you definitely want to go and get it checked out.
Yeah.
Or if they become highly lethargic. So they're just falling asleep. You're trying to get their attention and they just continue to fall asleep. That's an alarming sign.
Yeah.
Or if they immediately start vomiting, those are signs of like head trauma, head injury, and they need to go to the emergency room then. But if you have like a goose egg, you still call your pediatrician just to check if they need to be seen. And they'll probably suggest, doing a little ice pack where they fell, maybe a little Tylenol, children's Tylenol, infant Tylenol to get them through the time.
Yeah.
And then sometimes with falls, they might break their arm or something. So if you notice that they're just really being ginger with one area, you might want to get that checked out.
Okay. Great to know. It's even for, these refreshers, even just for me, it's helpful to be like, okay, these are the things to call the pediatrician for. These are the things to kind of wait and see.
Yeah. And I always recommend if you ever have just any concern, just call your pediatrician. That's what they're there for.
Yes. And they really are. You can find your good pediatrician, visit while you're pregnant, but they really are always so happy to help and just answer any questions. Because I think, you can speak to you. They get it. They're like, we see everything, and new parents are stereotypically a little nervous. So it's helpful to have that.
It is.
Sounding
and even doesn't matter how seasoned you are. So I had been working in pediatrics for a long time. And then when you have your own, it's very different. You're just extra like, oh no, what do I do? So.
Yeah. And then going over some more safety information, the car seat safety. I feel like this is a big topic, and, where to put the straps behind their shoulders and their armpit level and everything like that. So just if you want to share a little bit of information about the car seats with us, that would be
Yeah,
great.
the main thing about car seats is you want to make sure you have one that's in date. So they do expire.
Yeah.
You want to make sure you have one in date. That date is usually on the base of the seat. And if not, you can go online and look, and it should tell you where it should be. So you could check that. The other thing is making sure it's installed safely. So previously, you could go to the fire department. They would help you put it in or make sure you put it in okay. And they no longer do that.
Okay.
So now, and I've got to check my notes to see, is that it is called, you're looking for a nationally certified child passenger safety technician
Okay.
in your area. So these people are trained for this, and that's what they do. And you can find them online. If you're in Guilford County, you want to go to safetyguilford.org and find one locally here. But you can also look anywhere else.
Yeah.
And as far as the car seat safeties, a lot of them are all in one now. So they're rear facing, and they have certain stipulations based on the manufacturer for height and weight before they're turned forward facing.
Yeah.
And you really want to follow those
Yeah.
because it's in place for good safety measures.
Yes.
And a lot of times I always tell everyone to check the DMV website. That they usually have car seat safety information, or even going to the manufacturer online, and they can post like where the straps should be. They should be up higher, and so a lot of people put them lower. And when you're getting a baby in and out, they move frequently.
Yeah.
But you don't want it to be too high,
Yeah.
then it might be a choking hazard.
Yeah.
But definitely checking on those.
Yeah, awesome. And I'll definitely leave that website for Guilford County in our show notes so that people can check that out. And even if you're in a different county, just looking at it and taking that term, the nationally certified child passenger safety technician, is a lot of work. And Google it in your area because that is super helpful. I didn't even know that the fire department doesn't do that anymore. So that's good for people to hear too.
Well, and I didn't know till one of our aunts went and they told her no. And so she came by the house and she was like, what do I do? So I called a friend of mine that is a chief of a local fire department. And he was like, no, this is who does it now.
Okay,
So,
good to know.
yeah.
And then just a last question. We're so thankful for the fact that you teach our classes and also that you're coming on the podcast and giving this information to our listeners. And I just wanted to know, what is your why for serving people in the capacity that you do?
I think it's just something that I was brought up and raised in. Yeah. My whole family are big, volunteers and advocates in the community. And so it's just sort of what I've known.
Yeah.
And then sort of why I went into healthcare. Yeah. And so I've been in a private pediatric practice, little under 20 years.
Yeah.
And so just sort of teaching these classes are sort of natural to me at this point. Yeah. And I think a lot of times it doesn't matter how seasoned you are, you just need a village to help, or you just want to get the best information out there.
Yeah.
And just help others.
Yeah.
that certainly could use it.
No, that is wonderful, and we really appreciate it. So thanks for coming on the podcast today.
Thanks for having me.
Yeah.